Hello, sir. My name is John. I am your nurse today. I'm going to be doing a health assessment on you and then reporting that information to your primary care doctor. Before we begin, let me just ask you a few questions. Do you have any cultural or spiritual beliefs that will affect your stay here?
No.
Okay. So, if you were in the hospital and needed to receive blood, you'd be okay with that? Okay, great. May I ask, do you have any family history of any heart disease, stroke, hypertension?
No.
No? Anything else in your family? Cancer?
No.
Mental illness?
No.
Drug addiction?
No.
Okay. Do you know today's date?
Yeah, it's the 14th
Of
April.
what year is it?
2015, as I recall.
Yes, that is correct.
Nice.
Do you know where you are right now?
Yes, I'm in your house.
Good. You're in my medical office, which is in my apartment.
Yep. I know.
Okay. Very good. Yes, it can be a little confusing, but I do operate a medical practice outside of my office. Do you know who the president is?
Obama.
Yes, President Obama. Okay, very good. Now I will begin. First, just a couple questions, and while I inspect your skin. Oh, first, real quick, let me just wash my hands. Is it okay if I do the assessment without gloves?
Please.
Have you noticed any a change in the color of your skin tone?
No.
Okay. Okay. And when you've had any of these tattoos, no infections or anything like that?
No.
Okay, very good. That's quite a colorful landscape you painted on yourself.
Thanks, John.
It's Nurse John.
Nurse, Dr. John.
I'm a nurse.
Nurse John, sorry.
Yes, that's okay.
You're so good at your job, I think you're a doctor.
Well, that's not really how that works, but that's fine. Can I just inspect your hair? Okay, no lesions or itchiness?
No.
Okay, very good. Any hair falling out? Looks good. Look, good full head of hair. Okay, very good. Can you take your glasses off for me for a minute? Okay, good. All right, look straight ahead, and I'm going to shine a light in your eye. Okay. Okay. Very good. Now, look at the pen light and just follow it. Don't turn your head. Very good. Now keep your eyes on the pen. Just go straight in. Okay, very good. All right, you can put your glasses back on.
Thank you.
Can you just read the first two words on this back of this eye chart for me?
One of.
Very good. We will later perform the other eye exam in the other office where you look at something far away. Okay, now I need you to smile for me. Okay, raise your eyebrows. And now close your eyes. And you can not smile and lower your eyebrows. I'm just going to touch your face. Let me know when you feel me touching you.
Yeah. 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 Yeah.
Okay, very good. Now I'm going to test your sense of smell. Let me know what this smells like.
Fruit.
Okay, and now I'm going to change the scent. Let me know what this smells like.
Fruit.
Are you sure? Oh, see, I grabbed the same sample. Let me grab a different sample. What does this smell like?
Mint.
Very good. Okay, any changes in your sense of smell? What about your sense of taste?
No.
Okay, very good. I'm just going to take a peek up your nose. Okay, good. Now, I've been talking to you this whole time, but I'm going to try testing your sense of hearing in a different way. Okay? So I'm going to say something in your ear to let me know what I say. What did I say?
In here. Football.
Okay. And now this year.
Soccer ball.
Oh, very good. Okay. Now, can you open your mouth for me and say ah?
Ah.
Move your tongue side to side.
Ah.
Okay, very good. Now I need to inspect your throat. Okay? So first, will you swallow for me? Very good. And I'm going to palpate your pulses. Okay, very good. Now, if you would for me, just come sit near the edge of the couch and turn that way a little bit. Okay, very good. Now, first thing I'm going to do is palpate your neck again from behind. So just so you know. Okay, very good. Now I need you to turn your head to your right against my hand. Good. And again on this side. Okay, very good. Now, while you're here, while I have your back exposed, I'm going to put on my new headphone stethoscope. It's new technology. And listen to your lung sounds and pulses in your neck. Take a deep breath. Again. Again. Okay. Once more. Okay, now take a deep breath. Very good. Okay, breathe in normally. And you can go ahead and sit back. Before we go lower now, just listening right here. Any abnormalities in your carotid arteries. But you have none. Now go ahead and lean back all the way. Okay. Well, I still have my stethoscope on. I'm going to listen to your lung sounds in the front. Deep breath. Again. Again. And once more. Okay, very good. Now we're listening to your heart. You can just breathe it regular. Very good. Just palpate right here. Okay, good. Now just check your pulses, your wrists, your radial pulses.
Radio?
Radial. Your radial arteries. Okay, good. Okay. What I'd like to do now is have you lie down on the medical examining couch. Okay. You can put your arms to your sides. Now, have you had any pain or discomfort in your stomach at all since your last visit?
No.
No? Okay. Any changes in your bowel movements, color, consistency?
No.
Okay. Have you had any changes in your urine? No. Frequency, pain, color, odor? No? Okay. And before I forget, just general, full body system, have you had any pain anywhere else? No? Okay, very good. Seems like you're a very healthy young man. Okay, now you lift up your shirt a little bit. And I'm just going to observe. Okay, now I need to listen to your abdomen. Very good. Now, I'm going to palpate. Just relax. Let me know if I'm tickling you. Oh, it's tickling? Here, we'll try it like this. You put your hand on top of my hand. This should prevent tickling. Palpate a little deeper. Okay. I'm just going to... Good. Okay, very good. One more spot to make sure you don't have any problems with your major descending aorta. Okay, very good. Okay, while I have you lying here, Will you lift your arms up in the air? Okay, now put them against my hands and push. Okay, very good. Also, would you take your fingers and touch them to your nose? Okay, now place your hands open and touch your fingers to your thumbs. Okay, very good. All right, now I need to get to your lower extremities. First things first, just check your pulses behind your knees. Top of your foot. Inside your ankles. Very good. Okay. I need to feel your feet. Just lift your feet up a little bit and place them on the ledge here. Okay, good. Okay, good. Okay. Now, can you push against my foot? Push against my hand with your foot. And again here. And at the same time. Okay, good. And just lift your legs up and let me see if you can move them up. Okay, good. Now, will you run your one shin against your other heel? One heel against your shin, excuse me. Good. And again on the other side. Okay, very good. Now you can sit back up on the edge. Okay. And what we're going to have you do now is I'm just going to check your walking and balance.
Mm-hmm.
Okay. Okay, sir. Would you stand for me? Okay. First thing, would you put your feet together and close your eyes now? Just checking for your balance. Okay, good. You go and open your eyes and just take a few steps forward, walking heel to toe. Okay, very good. All right, you're okay?
Mm-hmm.
All right, now you can go and sit back down. Go ahead. Now just a few more questions. Is it 24 now?
23.
23, okay. So, do you drink alcohol? Do you smoke cigarettes? Do you use any drugs?
Smoke cigarettes.
No drugs or alcohol, though.
No.
Very good. So you smoke cigarettes. No, I just have to inform you, cigarette smoking has been linked to many diseases such as hypertension, stroke, heart disease, emphysema, COPD. Do you know what those are?
Mm-hmm.
Okay, and that doesn't scare you?
Nah.
All right. Well, do you have any desire to quit right now? No? If you ever do, please let me know and I can give you some information on how to quit smoking.
I will, John. Thank you.
Okay. Other information for your age group, it is very important that you do a monthly self-examination of your testicles. This is checking for any lumps or abnormalities. It's best to do this in the shower with warm water. Okay? And you just feel them and see if there's anything abnormal than what you usually feel. Pretty much just an extra lump. Okay? Also, I'm sure I don't need to remind you, but if you are having sex, please remember to perform safe sex. We have condoms on the way out for you to grab. Do you have any other complaints or questions for me? Okay, very good.
Thank you.
Take care.